the panel discussion. My name is Lara, and I'm the co-director for the strategic policy team. And I'm a policy and project manager working with various nonprofit organizations. I have a background in economics, and yes, I'm looking forward to tonight's discussion. It's supposed to be engaging, so feel free to use any of the chat buttons, raise your hands, ask questions, write down your questions, and it will be duly addressed along the lines of the panel discussion. So before we go ahead to tonight's meeting, we'll start off with a land acknowledgement. And it's important that we acknowledge that we're in colonial settler states where there is a continued oppression of indigenous knowledge, language, and culture. The preservation of ancestral connection is of utmost importance. And as an activist for STAND, advocating for anti-genocide, I commit myself to continue the fight against systemic racial injustice that aims to prevent the practice of the rights of indigenous people and their self-determination. And at this point, I would like to acknowledge that I'm in Toronto, learning, working, and organizing today on the traditional territory of many First Nations, including the Mississaugas of the Credits, the Anishinaabeg, the Chippewas, the Hodonises, and the Wendat peoples, which is now home to many diverse First Nations, Inuits, and Métis people. Once again, you're all welcome to tonight's panel discussion, and we're looking forward to engagement. So before we go on, I'll give a brief description about STAND Canada. So STAND is a national youth-led anti-genocide organization that advocates to make preventing and ending genocide a cornerstone of Canadian foreign policy. Tonight's panel topic is lockdown and locked out. Very apt given the COVID era that we're currently in. So we're going to be discussing the COVID-19 situation and the Safe Third Country Agreement. Along the lines of tonight's panel discussion, we hope that you leave with more information, more education around the STCA, and you're able to advocate and make a difference where you can. A little bit about the campaign that STAND Canada is currently on. So we started a fall campaign in September, and we're going through a 14 weeks countdown. Yes, we're going through a 14 weeks countdown down to the December. And this particular panel discussion is part of the 3 series of deliverables that we highlighted for the campaign. So the panel discussion is supposed to deepen education about the issues related to migration, COVID-19, and the STCA. For tonight's panel discussion, we have 3 distinguished guests. Yes, we have 3 distinguished guests that we're excited to have on board, and I'll go ahead to introduce them. So first of all, we have Dr. Ivy Lynn Bujold. Dr. Ivy is a professor in the School of Sociological and Anthropological Studies at the University of Ottawa and the University Research Chair in Gender, Diversity, and the Professions. She leads the Canadian Health Workforce Network and the Empowering Women Leaders in Health Initiative. Dr. Bujold has garnered an international reputation for her research on the health workforce, particularly from a gender lens. Some of her past projects have examined the migration and integration of health workers from a comparative perspective and on primary and maternity care workforce issues. So let's warmly welcome Dr. Ivy to tonight's discussion. Our next distinguished guest is Nicholas Kang. Nicholas writes extensively about immigration, refugee, and diversity issues. He has been honored with the Online Journalism Awards, and his work has been recognized by Urban Alliance on Race Relations and the Canadian Association of Refugee Lawyers. We are indeed pleased to have Nicholas on tonight's panel. And the last but not the least, we'll warmly welcome Jen McIntyre. Jen is the director of Romero House, a community that provides welcome, accompaniment, and advocacy for and with refugee claimants. Through her work at Romero House, Jen has been involved in the Canadian Sanctuary Network, the Ontario Coalition for Service Providers for Refugee Claimants, the Canadian Council for Refugees, and US-Canada Cross-Border Network. So at this point, we warmly welcome all the three distinguished panelists, and we're looking forward to an engaging, stimulating, provocative, and insightful discussion. I'll also remind the audience that feel free to use any of the buttons on your Zoom to raise your hand, ask questions, drop comments as we go on to the directed questions.
And if any point anybody has questions during the conversation, feel free to write your question in the chat. I will be accumulating the questions throughout the time frame that we have, and we'll be asking them to our panelists during the audience question period at the end.
Yes, thank you for that, Adi. So going on to the directed questions, we're going to ask the questions to specific panelists based on their expertise, their area of study, work, and experience. So I'll start out with Jen. At Romero House, you work with refugees to help them navigate the claims process. How has the pandemic affected the claims process? Has it created any additional barriers, be it in delays in processing times? Hello, Jen.
There, great. Now I'm unmuted. So thank you for that. I could take a very long time to answer that question because it has impacted people in really profound ways. But I'll look at four primary ways. The first one is simply that it's harder to get here and make a refugee claim because of travel restrictions. So we have seen the numbers of people who can actually enter the process drop dramatically. The second impact is from the reduction of in-person services that has impacted the ability of claimants to be able to simply complete the process of making a claim at the front end. So refugee claims can be made either at a port of entry, which is a land border or an airport primarily, or they can be made at an inland immigration office. And in both of these cases, one of the first and most important steps after indicating an intention to make a claim is undergoing an eligibility interview with a Canada Border Services officer or an Immigration Refugee Citizenship Canada officer. This interview is so important because it leads to someone having the temporary status as a refugee claimant, giving them identification, access to healthcare, the ability to work. And when the pandemic hit, these eligibility interviews simply shut down. They ceased to continue and have only started very slowly resuming in the past month or so. So this left these people who had come in just before the pandemic or were in the country and made inland claims in the months afterwards, it left people only with a one-page essentially Word document called an Acknowledgement of Claim form that in theory gave people access to school and healthcare and social assistance. But in reality, people really have struggled to access these services and have that document recognized. And one of the biggest challenges is access to work. So refugee claimants with the Acknowledgement of Claim form waiting for their eligibility interview haven't been able to apply for work permits. And if you can imagine, I'm in Toronto, in a city like Toronto with housing costs so high, it's almost impossible to survive on social assistance alone. So there's been a big problem. Nicholas recently wrote an article about it in the Toronto Star that I recommend that you all read. The third major impact has been refugee hearings, which also just stopped in April and left the Immigration and Refugee Board with a backlog of nearly 90,000 claims. The staff of the Immigration and Refugee Board were locked out of their offices until about June, and so they only started resuming in-person hearings, a very small number with lots of health restrictions in place in August, and are now moving towards having refugee determination hearings happen remotely, which is positive in some senses, but creates a lot of barriers for many people in access to technology to be able to join in on video conferencing. And then there's concerns related to quality of translation and just the effect of not having the decision maker in the same room as the person giving testimony. And then the fourth and final challenge or barrier that I will mention is just challenges for refugee claimants to access legal and social services as everything has gone remote, whether that's people's lawyers have gone remote, offices like ours at Romero House have gone remote, government offices. So it's difficult in non-pandemic times for refugee claimants to navigate our systems and to access services. So the pandemic has only amplified this. It's required high levels of digital literacy and access to technology, which many refugee claimants struggle with when they arrive. I mean, we see people trying to do everything on a smartphone, and a lot of the information that's out there is only available in English. So the City of Toronto has done a good job at trying to put information in multiple languages, but people are all over this country in different areas with different access to technology and understanding of even how to access services or what's even happening. So I could go on and on and on, but that's just a snapshot.
Oh, thank you very much for that. Yeah, it leads to the next question. For Nicholas, how has the media coverage impacted the situation of refugees and asylum seekers with regards to the STCA and COVID-19? You're on mute.
Is that working, Ivy? Sorry.
The question is for Nicholas.
Oh, sorry. I am unmuting you. My apologies. Here we go.
Okay, perfect. Great. So first of all, thank you so much for having me here on the panel tonight. The media has a huge impact in framing public narrative of any issue, and it's no exception when we talk about refugees and migrant issues. Whether the media is calling migrants, asylum seekers, illegals, undocumented, non-status, or irregular, all these labels actually create different images and meanings and implications. Just to give you a little bit of context, when migrants in the US started crossing the land border into Canada after Trump was elected president, initially many media outlets used the term illegal migrants, but slowly the language was changed. And I think it had a lot to do with our government, the Canadian government officials, who actually adopted the terms irregular migrants and asylum seekers, and which I believe is intentional in a very subtle way to create a more neutral language to describe, you know, the what some media call the border crisis. So when the pandemic started in March, initially Ottawa still allowed irregular migrants to come through, but they closed the border on March 20th for public health reasons. And it hasn't reopened since then, except for those who meet the exemption criteria under the Safe Third Country Agreement. So now the concern over public health in Canada is legitimizing and justifying the policy so now the concern of the public health is legitimizing and justifying the policy to restrict entry of asylum seekers and refugees into Canada. and the impacts of that hyper concerns over public health threats is actually larger than just on the border crossers. I feel like that actually has extended to any travelers coming into Canada, including irregular migrants. And I feel like it's both a reflection of public sentiments at the time, at the beginning of the pandemic, and to some extent, of some legitimate public health concern. But the consequence was and still has been this surge of, in my view, what I call xenophobia. It's not just against foreign nationals, but members of racialized communities in general. What I found also interesting in terms of the media coverage of the pandemic and on asylum seekers is the fact that we at one point we also cover stories about asylum seekers who happen to be essential workers working on the front line. And when some media, even including the Star, actually pushing for the status, legitimate status for this particular group of migrants. But I think it only happened because of the part of that, emerging public narrative, about the social inequity and social injustice exposed by the pandemic, about all this different marginalized groups who are not able to work virtually, but have to work, at grocery stores, PSWs, for example. So I think that's partially, how media coverage actually plays a role in directing public opinions in a way. And also on the negative side, for example, we are aware of the media coverage, about the outbreaks, the COVID-19 outbreaks at refugee shelters here in Toronto. And it raised a lot of concerns, but interestingly, when it comes to outbreaks of refugee shelters, I think the irony was, the concerns was more about how potentially these refugee shelters could potentially spread, be a threat to community health, to the community at large. And so I feel like, in terms of the media coverage, how much is it actually directed by public opinions, public concerns, and how much was it the media actually leading, framing these issues, and how political leaders at the provincial, federal governments, actually frame these discussions about public health, about COVID-19, and about asylum seekers. I think we all play a role in framing the public opinions one way or the other. Yeah.
Okay, thank you so much for that, Nicholas. I find that the media, just a follow-up question, sometimes would you agree or disagree that the media exacerbates the issue on ground, or what's your own take on it?
So sorry, can you repeat that?
What's your opinion? Would you agree that the media exacerbates the issues on ground, or it actually gives public confidence on the issues on ground?
It's a tough question because I think from the are you specific referring to the refugees or in general?
The refugees for now.
Okay. Certainly, I think for the media, the access for us during the pandemic is an issue in terms of our coverage. Since March, like most other media outlets, the whole newsroom at the Star has shut down. So we are reporting remotely. And for us, it really limits our access to talk to what we call in the media, the real people whose voices are often, overlooked. So instead, if you notice a lot of media coverage, during the pandemic, you would notice, we have more like, experts' voices, politicians' voices in stories than real people who actually lived in those realities, just because of some of those logistical challenges. Yeah.
Sorry, we were dealing with the problem of people not being able to mute and unmute themselves. So I'm just going to make everybody who's speaking today a co-host in this event. And then hopefully that will solve that problem.
Okay, I'm unmuted now. Okay. Okay, thank you for that, Nicholas. We'll be moving on, and the next question will be directed at Dr. Ivy. Dr. Ivy, so how has COVID-19 affected the migration and integration of the health industry? How reliant is Canadian health system on immigrants or migrant workers? And in particular, what do you think about the proposal to regularize the legal status of asylum seekers who work in the healthcare sector and care homes during the pandemic?
So thank you for those questions. And those are really, really important topics to look at. So I'll talk first about how the COVID-19 pandemic has affected the migration and integration of health workers. And so this is something that I've studied in terms of migration to Canada and what have been the impact on, what we have referred to as source countries. And so health workers are really sort of what we refer to as a hypermobile set of workers. And this pandemic has made them all immobile. So this is remarkable. It's the remarkable immobility of a very hypermobile set of workers. And so it's important for us to also acknowledge that our health system, so although, we discuss issues around, refugees' access of the healthcare system, but we also need to understand that immigrants and refugees, to a certain extent, are part of our healthcare system. We are really quite reliant on, a term that we use, internationally educated health professionals who are working within our healthcare system. And it's hard to kind of say how reliant we are on that, because it really depends on who you're counting and how you're counting. So I can give you an example of physicians. So in those physicians who are registered to practice, approximately 22-23% are internationally educated. Some of those are Canadians who have gone abroad and have come back, so they're considered internationally educated. And then there are also people who are not Canadian born who have migrated to Canada. So that percentage will actually only capture those health workers who are actually registered and licensed to practice. So there are a number of internationally educated health professionals, and physicians, are quite predominant, who are not integrated into the health system as physicians. So let's just park that thought for a moment. In the case of nurses, the percentage reliance is lower in the area of sort of 7 to 9%, depending on what year you're looking at. But because nursing is a much bigger profession, it means that there are many more immigrant and refugee and internationally educated nurses who are in the system. So that's doctors and nurses. Those are those we count. And those are those we count who are registered in the system, but there are a whole host of them that are not registered and who are not integrated in the system. And the way that they become integrated into the healthcare system is in the area where we don't count. So Nicholas had mentioned PSWs, personal support workers. That's the term we use in Ontario. It's healthcare assistant or continuing care assistant in other jurisdictions. But these are largely workers who are providing support in home and long-term care. And if you know the statistics, Canada, it has recognized internationally, not in a good way, that the we have the disproportionately largest number of deaths in long-term care than all international countries. So that's where our deaths are experiencing. That was, coming out of the first wave, and it'll be very interesting to see what comes out of the second wave. So in the case of personal support workers and healthcare aides, we don't count them at all. I mean, they count them to a certain extent. They have a registry in Alberta and they have a registry in Nova Scotia, but here in Ontario, we don't. So I can't tell you how extensive it is, our reliance on immigrants in the older adult care sector that's either at home or in long-term care or in retirement homes, again, which is another sector that has been hard hit. So the issue, sort of the proposal that's in part of your third question, do you think the proposal to regularize the legal status of asylum seekers who are working in this sector? Absolutely, right? They are essential workers, and there's a variety of different ways that we need to valorize and support these workers. So you saw early on that the workers were given additional pay. It's important to recognize how poorly paid these workers are. And despite the fact that we think of their work as unskilled or lower skilled, I would argue that their work is very highly skilled, right? And they're doing very, very difficult work. So we devalue the workers just as much as we devalue the people for whom they work. So older adults and immigrants. And so what you will find there is this really sort of toxic situation. So these are sectors that, were not considered for personal protective equipment. In some cases, they were told they didn't need it. So it spread like wildfire through these places. And what's so sad is it seems like we're still not learning a lesson from those circumstances. So let's take a case in point of internationally educated or immigrant or refugee health workers who are working in this really difficult sector. So because they're so poorly paid, and they often don't have full-time positions, so they work across a number of different long-term care homes. And so that they become, a source of the spread of the virus. So they don't have personal protective equipment. They have very poor wages. They have to make ends meet by working, to get as much full-time work as they can across, 2 and 3 facilities. That means they are a vector to spread this. They go home. They are disproportionately living in very poor social housing circumstances. And it's really important for us to recognize that the ability to social or physical distance, whatever term you want to use, is a privilege. It's an absolute privilege. And so I think in many of our, lockdown policies, there's this assumption that we have a house with a backyard and we can close our doors and we have our nuclear family. And that's simply not the case. People are living in really challenging housing circumstances. They're working in really, really challenging working circumstances. So it's this multiplicative impact on their vulnerability through this pandemic. And that's what we found out through the first wave. I'm just really worried to see what we're going to find out in the second wave. So those would be, some of my initial responses to really, really important questions that you have outlined.
Okay, thanks for that, Dr. Ivy. So now the question is not directed towards any of the panelists in particular, open questions, and you may choose to respond. What kind of lasting impact do you think COVID-19 will have on patterns of migration?
Maybe I will take a stab at it. I think it's too early to predict the long-lasting impacts of COVID-19 on the migration patterns. But if you would like to take a futuristic look at it, I think it could potentially turn the system upside down. On the skilled immigration front, I almost like, given that a lot of essential workers, they need to be physically in Canada, for example, like caregivers, farm workers, for example, they really need to be admitted in person in Canada, as opposed to some other quote unquote highly skilled IT workers, engineers who can actually work remotely. So are we going to have the system reversed so we would grant permanent residence a pathway to farm workers and healthcare workers and truck drivers, and then allow, only temporary, in our temporary foreign workers program, we only let IT people and professionals, highly skilled professionals, to come in through as temporary foreign workers, or even like whether potential skilled immigrants, would find the need to be physically in Canada to be employed. Obviously, you can still have the arguments, if you worked in Canada, you likely would get better paid than as if you worked in India or in the Philippines, just because of the cost of living. So I think that would be interesting to see how our immigrant selection criteria would change as a result. So on the family reunification front, I think it would still remain steady. We shouldn't expect too much, too much changes. And on the humanitarian program, which is, I guess, a lot of today's audience would be interested in, I think it would geared more towards skills-oriented selection. Is already a trend that we have been seeing with, I'm not sure whether you've heard about the work done by Talents Beyond Borders. They actually, it's a program that profiled the skills and education of refugees from overseas, from camps, and matched them up with the skill shortages in different countries. So instead of selecting refugees who are the neediest for assistance, refugees selected for resettlement, being selected because of their skills. So I think that would be, something that we should look for. But I think overall, the flow of migration will always remain the same, will be the same from the global south to the global north. And I recently actually did a story about the adoption of AI, artificial intelligence, in controlling, they call it managing migration, I call it controlling migration. In terms of how AI is being adopted across Europe to track migrants, their movements, and in the guise of public health needs. For example, they say they need to track them as part of the coronavirus tracking, to adopt those technologies. And indirectly, use those data, those information to monitor movements of migrants. So I think that's something that, that report, by the way, if you're interested, it was published by Mozilla Foundation, and it was conducted by Canadian human rights lawyer and researcher Petra Mona from York University, Refugee Hubs. Yeah. And yeah, definitely, I think those would be a few things that we need to look for, when we, as we move forward after COVID.
Okay, very insightful. Thank you. So my next question is also an open question. Without the
actually, if I could just add to what Nicholas has said, I think I really want to stress how, right now we have a system, a very bifurcated system, where so-called lesser skilled workers that are working in long-term care, or working in meat packing plants, or working as agricultural workers are given only temporary immigration status. They have very, very poor living and working conditions. And whereas we have another group, the other part of the bifurcation is these very termed highly skilled workers. They are given permanent residency status, so they're not temporary. So they're given very different types of rights and privileges in the system. And Nicholas raises a really important point. I mean, the reason why we have temporary permits and temporary foreign workers in these areas is because they are not sought after jobs. I wouldn't call them not skilled jobs. They are not sought after jobs. And so I don't know whether or not we're going to see a remarkable number of people in Canada applying for those jobs. When we did surveys and interviews with employers of long-term care centers, they said, they just can't find Canadians. And this is the reason why they look internationally to recruit, again, because these are not highly sought after jobs, but they are jobs where we absolutely need to be here face-to-face in person, right? There's no way to develop an AI system or to remotely change an older adult's diaper. I'm sorry, it's just not going to happen. And so I think we really need to think about that. Then what are essential workers, and should they not be not just valorized by us clapping about them and saying that they're heroes and creating murals about them, but how do we reflect that in our policies? And also I'd like to just sort of add, an explicit gender lens on this, because you have disproportionately men who are going to work in the meatpacking plants, as agricultural workers, and they've launched complaints about how they have been disproportionately impacted by COVID. And the older adult care workers have also been disproportionately impacted. I was mentioning in my last comment about how we don't count things, like we weren't counting the healthcare workers that died as a result of COVID until July. And it's still not exactly clear who counts as a healthcare worker and what information we capture. That we are really, really bad in Canada at capturing any data on race. So in the absence of any information about the healthcare workers that perished as a result of COVID, we gathered information from publicly available sources through the media because there were no quote unquote official sources. And so of the 12 workers who died, 8 were in long-term care and disproportionately racialized groups and disproportionately immigrants. And so I think that we really need to reflect on that as a society in terms of how we approach this going forward.
Okay, thank you for that, Dr. Ivy. The next question will be, without the STCA, the number of asylum seekers may increase. What do you think about that? Would Canada have enough resources to handle a potential influx?
I can take a first stab at that question. I think the word influx is so interesting to me because that was a word that was used so much back in 2017 when we saw quote unquote large numbers of people coming through Roxham Road, mostly Haitians who were worried about losing their temporary protected status in the United States. So in 1 month, about 7,000 people came through Roxham Road. At the same time, on the other side of the world, 500,000 people fled from Myanmar into Bangladesh. 7,000 people, 500,000 people in the same period of time. And when you look at Bangladesh, which is a country with very few resources themselves to be able to support a population like that, and then you look at Canada and you really look at, like, do we have the ability to receive an influx like 7,000 people? I think putting it into perspective like that really changes our ideas of what is an influx of people. But certainly, I think that there is very little evidence to show that suspending the Safe Third Country Agreement, ending the Safe Third Country Agreement would lead to a surge of people coming from the United States to Canada. And it's also something, I think one of the arguments that advocates have made is that suspending the Safe Third Country Agreement really should be something that should appeal to all political parties, because for those parties that are really looking at, upholding our human rights commitments, that would make Canada an accessible country to people seeking protection. And for those who are more conservative and in favor of what they would call orderly migration, that making sure that people had the option of having their claims processed at an official port of entry would sort of solve the problem of irregular migration. So in a very strange way, the former Minister of Immigration, Chris Alexander, has become a strong advocate. Like, he was Harper's Minister of Immigration and has become an advocate for suspending the Safe Third Country Agreement, which is incredibly ironic because he never argued for that when he held the position of the Minister of Immigration, but now has, you know, in the role he holds in the world now, is able to come out and speak sort of the rational argument for it. So yeah, I would say that we don't need to be worried at all about what we think of as an influx of people coming through the border.
And I just want to add to that too, like, to be honest, like in my dealings with asylum seekers through the years, most refugees, their final destination is the US, not Canada. And I think what we've seen the last 4 years was actually an anomaly because of President Donald Trump being elected. And I think, you know, we all, you know, biting our nails on November 3rd, the night of November 3rd, you know, watching the election results, you know, with him gone, like, I'm quite confident that that kind of northbound traffic will likely slow down further, if not completely stop. Obviously, you know, right now the border is shut for any traffic. But I think, you know, given the new development that we are having a new incoming president in the US, and the fact that, you know, we have been relatively, I think we have been able to handle the so-called influx the last few years. I think we would do okay without the Safe Third Country Agreement. As you know, and I think, you know, the US actually, I'm surprised that, you know, the US would actually sign this agreement in the first place, you know, sorry, the other way around, like Canada would sign it because, you know, what do we have to, what does Canada get out of it? Because when most people actually wanted to go, you know, it's the US, and we don't really get a, you know, a whole lot out of the agreement, in my view, until, you know, Trump.
It is very interesting also to, again, to take a gender lens on this, because, you know, part of the Safe Third Country Agreement is this presumed fairness in the United States, or, you know, vice versa, the presumed fairness in Canada. And what we have seen have been that people who have been returned to the United States have been retained in some really, really awful circumstances. And these have been brought to light by, you know, really important organizations, some of whom might be here, Amnesty International. And particularly on, you know, from an issue from gender-based violence, they do not have sort of the same recognition of the legitimacy of gender-based violence as a claim to refugee status. So that disproportionately impacts those who identify as women. I think that it would disproportionately impact those who are transgender, who have an even greater experience of gender-based violence. And I mean, we're coming up on the UN's 16 days of activism around gender-based violence starting November 25th. And so I think it's really important to look at these issues as well. Women will disproportionately come with children. Children have been detained in the United States. They still can't find the parents for 345 children who are locked up in, you know, former you know, facilities. And so, I mean, these are really critical things for us to re-examine, you know, what the Safe Third Country Agreement agrees to implicitly or explicitly. Our hopes are all placed in, you know, a new regime coming in the United States, you know, having, you know, the new vice president, you know, who really has focused on issues from a gender-based perspective, from an intersectional lens. And I think that that's really important, but it's important for us to kind of unpack what the Safe Third Country Agreement means to a variety of different people who are claiming refugee status.
Okay. Any other comments around that question before we move to the next question? Okay, my next question says, given that closing borders seemed to be an effective way of curtailing the spread of the virus, how will the government balance between the pandemic and the closing of borders? Should asylum seekers be considered as essential travelers?
Absolutely, they should be. I think if hockey players and athletes who are performing for our entertainment are considered essential travelers, people who are fleeing for their lives and seeking protection in our borders should definitely be considered essential travelers. And I think the Canadian government has demonstrated that they recognize this in some way by having, after the first month of the pandemic, opened the border to people who were exceptions to the safe third country, but they certainly did not go far enough in determining that anybody was an essential traveler. And essentially, by turning people away who are trying to irregularly cross and make claims, like, we are violating our own immigration laws and our international agreements. And as it stands right now, people who enter the country and make a claim and are allowed to because they're an exception to the safe third country, so they have a family member in Canada or they're an unaccompanied minor, they are required to quarantine for 14 days. And so if they have family here, they can quarantine with their family. If they don't have a suitable quarantine option, then the government will quarantine them in their, we call them the immigration hotels in Niagara and Toronto, at least in Ontario. And so there is easily a way for the government to manage the health concerns of the pandemic and still live up to our humanitarian commitments. We don't have to choose between those two things. So yes, I would say absolutely, they are essential travelers. Our government just isn't recognizing that.
I would absolutely agree. And this is with, my one hat, which is I have a PhD in public health. And so I agree with that. People who are traveling at the border, they are not the main source of spread. And I would hate to see some type of, siren being said by, this is what's happening, is that, they're spreading the virus. This is not the source. Jen has outlined, all of the provisions that there are for how this can be accommodated in a really safe way. And so, yeah, I would absolutely agree with that.
And I just want to ditto what both Jen and Ivy actually said. What I find very interesting actually is there's a public perception out there that, the people who are coming in and out of Canada now, these are, foreigners, foreign nationals. But if you look at the numbers, most of those travelers now who are flying in and out, or crossing the border, they are Canadian citizens or permanent residents. Actually, very few, not very few, but there's some, but unless they're essential workers, they are not allowed to go in and out. Is that mindset that only non-citizens and non-permanent residents are going to carry the virus? I find that interesting, and I think we do need, to do more public education to realize that, travelers are not carriers, but it's irresponsible travelers who are who are carriers. I just hope we would have a border policy where we could distinguish irresponsible travelers and maybe ban someone, even Canadian citizens, such as I don't know whether you guys remember that the guy from Toronto, from GTA anyway, by the name of Chris Sakochia, who was actually a strong advocate for an anti-mask advocate, who was arrested and fined, flying from Toronto to the Maritime province to campaign for campaign for people not to wear masks. So I think people need to distinguish really who actually are the threats, public health threats.
Yeah, absolutely. And I think that's also, I mean, it's not that I would ever argue that it's was okay to close the border at any point, but there's a difference between like 1 month and now 9 months. And looking at, things aren't getting better in the US. So likely the border is not going to reopen anytime soon between our two countries. So to not accept refugees on Canadian soil for such a prolonged period of time is incredibly concerning. And we do see that if people are desperate, they will find a way to come to Canada. So between April and October of this year, there were about 200 refugee claims that were made by people who did cross the border irregularly somewhere. We have a very long border and were not detected and made inland claims. And like those people probably didn't quarantine the 14 days when they came in the country. And that is not what we want. So to allow people to come in and make a claim and go through a quarantine process is safer for them and safer for everybody living in our borders.
Okay. That was very insightful. I like the ring to that there is need for more public education that travelers are not carriers. Irresponsible travelers are the carriers. I like the ring to that. So we'll go on to more questions. If you had the chance to sit down with Justin Trudeau, 6 feet apart, of course, given COVID-19 restrictions, what would be your top policy recommendation?
I would have such a list, and I don't know that it would start with immigration necessarily, just because, I would probably focus on policies that would have an impact on immigrants, but have an impact on all of us more broadly. We have I wouldn't call it a campaign, but just, to try to kind of recognize that, to revalorize care work. And the lack of value that we have in the care work that disproportionately immigrants are providing for older adults, that's critically important, but also childcare work. So care work, we're saying, supports all work. And I couldn't design a natural experiment better than this one to make that point, that care work supports all work. So, people are at home trying to work while, doing virtual school for children. Childcare isn't open other than for essential workers. There's a concern about spread. And so we have, like, both from early childhood education and early child care work all the way to older adult care work, it's really being seen as essential work and so important. And so should we not have some type of system that pays all of these folks for the essential work that they're doing, recognizes the skilled work that they're doing, and the importance of, we use the term relational care. We develop relationships in caring for older adults and younger children and people all throughout the ages. So that would be my thing, is to say that care work and our care infrastructure, they talk about build back better, then you build back, from the ground up what is absolutely essential, and then go from there.
And I think, what I would say is, what I would say to Trudeau is use common sense and have an agile system. And also, as I said earlier, I think it's really important to have some sort of public education campaign to let Canadians know that, is the stupid, irresponsible people and not refugees or immigrants who actually spread the virus. If you look at the data, I'm sure you would find that the community spread is a more serious issue than imported COVID-19 cases. You can always argue that that's because the border has been closed. That's why we're not seeing a huge import of these cases. But I think it comes down to the fact that if we could have responsible people we can control the spread of the virus. And also another message that I would have for the Prime Minister is, please reopen the refugee resettlement and sponsorship program, because this is the time, I think they need to be here most and quickly.
Yeah, I think I would encourage our leader to show some creativity and flexibility in policy, like think outside of the box. So often, like in our systems, and I mean, my knowledge is all in our immigration systems, but in our systems, we fit people into these little categories. And one of the biggest challenges for refugee claimants is that if you're in the refugee claims process, you can't also simultaneously engage in any other immigration process. So sort of like concurrent pathways to look for status in Canada. So right now we're in a situation where we had like 90,000 claims at the Immigration and Refugee Board waiting to have their hearings determined. And because of travel restrictions, we are way below our immigration targets for this year. Yet you have all these people who are in the country, and many of them are skilled or working in all sorts of different areas. And so by looking at alternative ways, rather than keeping all of these people waiting in limbo and having, work and jobs that need to be filled by people who can't arrive to the country, why not offer an immediate alternative pathway to the people who are already in this country to give them permanent status? And it doesn't have to be within the box of this refugee determination system. And we sort of have, under immigration, anyone who doesn't fit in this category or this category, everyone gets streamlined to this humanitarian process, which is a really inferior system that doesn't really fit most of the needs of the people who are looking for permanent status in some way and deserve permanent status some way in Canada. So that would be my encouragement, is to show flexibility, to show creativity, to think outside the box and sort of get out of these like streamlined processes.
Awesome. And the final question on the open-ended side is, recent report from ICES shows that immigrants or refugees make up a large portion of COVID. What are some reasons and how can they be addressed?
Well, I'll pick up on sort of what I said before, like some of the main reasons are their exposures at work and their exposures at home. So there's nothing inherent, in someone's immigration status that makes them more or less susceptible. It's their behavior and their living and working circumstances. And so if we could, address those issues, that would be how we would address it. So that's another sort of broader issue. They're talking about having, minimum income, building off the CERB. To do that, some like minimum housing requirements, I think would be really important. So it's as we say, the social determinants of health, it's the broader living and working conditions that's really causing the increased susceptibility to the virus, and also just how all of the other stressors in your life of being in a low-waged position exacerbates your inability to resist viruses. So it's much broader in terms of social determinants of health than particular immigration status.
And we saw in Toronto early on in the pandemic, one of the major shelter outbreaks that happened was in a refugee-specific shelter in Toronto. And I mean, going back to Nicholas's first question in terms of the media portrayal, it's also how social service workers speak to the media. I think there were some really unfortunate comments made by managers at that shelter that sort of fueled this perception of like irresponsible shelter residents being the causes of this. But in reality, that was a brand new shelter that had only been opened in, I think, November or December, like 4 months maybe before the pandemic started. And so they were still, their spaces weren't even developed yet. They had lots of renovations that were going on. Their staff were all new. And so the ability of that particular shelter to come up with practices to prevent the spread of this just simply wasn't there. There wasn't sort of the work culture to be able to support that. So in a way, I mean, I just think that that's sort of, it's unfortunate bad luck that happened to be the reality of that shelter, and it was a refugee shelter. And I think that we've seen outbreaks in other shelters as well, but I think that particular one was a very contextual outbreak that had nothing to do with the fact that the people who were staying there were mostly refugee claimants.
Okay, that's very insightful to hear. So while we're speaking throughout the discussions, the audience have lots of questions. So we'll start out, Stephen from CPJ asked the question, can Canada justify maintaining the STCA with the hope that a new president will ensure safety for refugees?
Well, that's a really, really important question, because right now the the stay or the delay in the court case gets us to 2 days after inauguration and gets us to January 22nd. And so that'll be very, very interesting to see what happens with those decisions. And that's also predicating that, the president-elect can get access to anything and do anything in this, transition period. So it's a very difficult and a really, really important question to pose. And, I come down to this issue about, again, from an explicit sex and gender lens, how is this disproportionately having effect on men and women? And if our prime minister, wants to say that, gender-based analyses are really, really important. He has an entire ministry about women and gender equality. They are really pushing a focus on gender-based violence. This has gone through the roof. Gender-based violence at home during the pandemic. And that's not just amongst the refugee population, but we really have to attend to these issues. So I personally would like to see something explicit in the area around gender-based violence and this presumption that they would have a fair process in the United States before I would, suspend anything.
Yeah,
So at this point, okay, you go ahead, Jen.
Yeah, I was just going to say, quote Maureen Silkoff, who is the president of the Canadian Association of Refugee Lawyers, in an article that she put out recently, where she wrote that human rights are too important to hinge on promises or hope. And I think that's really important. It's not just a hope that things will get better under Biden. It's a reality that human rights abuses have been happening in immigration detention in the United States for 5 decades. Not that it's something that's new that happened under Donald Trump. So the challenge to the Safe Third Country Agreement wasn't a challenge to Trump's immigration administration. It was a challenge to long-standing issues that had been happening in that country and that are not going to end as soon as Biden becomes the president.
And I too believe too that I don't think Safe Third Country Agreement would be on top of the incoming government's agenda. As much as I like to have hopes, like everyone else, in the incoming administration, but one is there's still an outstanding court challenge in Canada right now, and the problem most likely is just going to take a wait and see mentality. And second of all, I just think, as I said earlier, under the Safe Third Country Agreement, I think in collaboration with the domestic immigration policies in the United States under Trump, the U.S. really, had nothing to lose to have all these refugee, asylum seekers, undocumented people leaving the country and move northbound to Canada. So I highly doubt whether, it would be just, thinking of it like politically, whether they have anything to gain, for the next administration to gain by doing away with the agreement, unfortunately.
Okay. The next question is from Olaide Stan, Canada. We know that eligibility for immigration loan program begins from refugees' country of origin, covering the transportation and medical costs. How has the program fared during the pandemic?
Yeah, I was just going to say that my work is predominantly with refugee claimants, so I can't answer questions more about overseas sponsorship.
I don't know because I have not, investigated into this issue about the loan, but I just assumed, given that the sponsorship, the resettlement programs essentially has come to a halt the last 8 months. I doubt, given that, the refugees are not being admitted into Canada, and I don't see there's a need, for them, for anyone to apply for the loan or to process the loan applications. But it's just my assumption. I don't have firsthand knowledge, but I'm just guessing.
Yeah, I don't have knowledge of that particular program, but what I find really remarkable about the conversation that has emerged thus far is the lack of attention that there has been to some of the implications of the pandemic on, the halting of these programs, the limbo that so many people are in, the knock-on effects, the unintended consequences of particular policy decisions that have been made. And, I find that, the media has been so focused on the US election, and I appreciate that that has been important, but it has meant that really important Canadian stories that are being experienced by people in Canada are just going invisible. And so I think, hopefully things will have calmed down, because of, the craziness south of the border. And I hope that we can start paying attention to these really important issues that our politicians and decision makers need to address, because there are so many knock-on effects of how we have responded to the pandemic.
Okay, another interesting question from Diana, Stan, Canada. There's been a recent push for healthcare officials or government officials race-based health data. Do you think this is a good idea, or will it cause more xenophobia, racism?
If I could say, because I've been advocating this for a very, very long time, we absolutely need to collect these data. It otherwise makes the problems invisible. And collecting data is not the reason for racism. Racism will exist in the absence of data and in the collection of data. It just will go on. What it means if we don't collect these data is we don't understand the disproportionate impact that, anything happens on anybody. The disproportionate impact of, COVID on the broader population, of COVID on the health workforce population and those of essential workers. And so we absolutely have to do this. This is, I can't believe that I'm still having to say this in 2020, and yes, I know they collect, much better race-based data in the United States. I mean, that's not what causes racism in the United States. It's not that they collect race-based data. And yes, people are going to misuse data. Absolutely. We just have to recognize that that's going to happen. But that's no reason to say that, oh, we shouldn't do this, because it just means that we're quietly racist and we're invisibly racist.
Is actually very interesting. Just today, there was actually a column in the Toronto Star by my colleague about the recent racial statistic, racial data, race-based COVID data came out from the city of Brampton here in Ontario, which found a very high proportion of positive cases among the South Asian community in Brampton, which is a very high concentration of South Asian newcomers in the city. And the columnist actually raised a very good point that that it is not, it's great. I think the data itself is neutral, but what is behind the numbers, I think that's what matters. What the columnist did in counter, in her column, in response to a previous column in the paper as well, and in the media the day before, where that columnist was just pointing out, yes, South Asians, they are the source of the virus for the city of Brampton because of the culture. They live with multi-generation within the same household. The celebration of Diwali, like almost came across as a sense of blaming the community. But the column that appeared in today's paper was explaining the fact that so many of the community members, as newcomers, they work on assembly lines, they worked at warehouses where social distancing is not possible. They also cannot afford to work from home because they have to work to make, they don't have sick leave, paid sick leave. And also it talked about the positives of living, in a multi-generation household, the kind of family support of their parents. I think, it's how you use and interpret the data and explain the data. That's more important than here is the number. It could be used and could be misused and abused, right?
A follow-up to that, Stephen from CPJ asks, what are possible solutions for COVID-related racism?
Well, if I could start by saying that is asking the question, or what are the possible solutions to racism? COVID is just the most recent expression of racism, right? It's not like racism, has magically appeared because of COVID. COVID has made apparent so many previous cleavages, like in terms of poor housing, disproportionate difficulties in terms of working conditions. So it has laid bare, many of these circumstances. I mean, even, what they call the second pandemic of, violence against women. It's not like it wasn't there before. COVID has just really shone a lens on all of these things that are happening. And so I think that this is just, another form of expression of racism. I think that it's exacerbated because people are in very vulnerable circumstances, either, because they've lost work, or they've, are at their wits' end, because they're trying to work from home or trying to care for kids at home. So everybody's really on edge. And so people have less grace. And so they will express, these attitudes, which may be much more subtle and subdued in them. And I also think that, with the expressions and whether you call it Trumpism or nationalism or whatever, we've enabled, people to release that in a way that's now considered not as socially inoffensive as it was before. So I think there's all of these things that are combined, but it's not like COVID has caused racism. It's just made it apparent, in a really unique way.
And I think that every single one of us actually has suffered. Our mental health has suffered during the pandemic. And, and sometimes I feel like it's almost like natural for us to try to justify our experience, to legitimize our experience by pointing fingers and by blaming others for the problem when it's a natural crisis, disaster that we all experiencing. And I think, it's not to say that, racism was not there, but I think that people are looking for an outlet to vent. And in terms of how to address, racism, it's kind of interesting that recently, I think in early fall, in September, I did a story about the racial reckoning. And I spoke with, during COVID-19, and I spoke with a bunch of people, activists, and also members of the community who were reluctant, to talk about racism, given, the Asian culture, or they couldn't see racism. But I'm sure you recall the late George Floyd, who was killed in police violence in the States in early April. And essentially my story was about that collision of Black Lives Matter, the movement in the States, and how that, led to a reckoning of racism when everyone actually being isolated at home, not working, they had the time to process information and process their experience. And it led to people looking out for more information. They have the time to get engaged, to get motivated to join organizations like Zoom panels to talk about racism. Those are some of the positives that came out of this collision of forces that also I think the pandemic made some people to blame others for their mishap, but it also, I think it has brought out some positives for people, especially victims and allies of to mobilize them to talk about it. I think it starts with discussing, because racism is always very difficult to talk about. I find sometimes some people, they just don't have the language because it's even institutionalized into ourselves, as a minority person as well. You just don't realize it, and we all have that biases, even among different racialized groups. And I think the pandemic in a way provided some of the people the opportunity to talk about racism in the society. And and think so often people compare racism in the States and in Canada. And I've lived in the States, I went to school in the States, and if you talk to those people who have lived in both countries, like a lot of them would share the same feeling that racism in the States is blatant. If people don't like you, they tell you. And here in Canada, you don't know who are your friends, who are your foes, because it's so subtle. And I really think that and hope that this would give all of us the opportunity to talk, to first talk about racism here in Canada, and then move forward. So how we can address, in terms of action plans. And we are seeing some of those movements, a lot of, corporations, coming out to, whether it's lip service or not, but at least, they show the initiative to do something to address diversity, the representation. You see, TV shows trying to get that diversity. Things are happening, but it's not like the media is there to report every little change that's and initiatives that's happening. So, but hopefully, we're going to see positive changes coming out at the end of the tunnel.
Yeah, racism, the topic can go on and on. There's so many dimensions, it's mind-blowing. One more question from Adi, Stan, Canada. If you could change the way we talked about skilled work to emphasize, or in other words, how is skilled work different from essential work?
I think that's a critically important question. I think it has implications for our immigration system, what is recognized as skilled work and non-skilled work, but I think it has far-reaching implications. It intersects with gender, with race, what work counts, how do we remunerate that work? white, patriarchal, colonial notion that the only type of work that's considered skilled work is one that comes out of a university degree. I think we have to open that up and expose it for what it is. It's a system of social closure that creates people who have it and who don't have it. And if you have the money to go in and I'm part of of this university system that creates these credentials. So I mean, I'm privileged in the sense that I have the ability to critique the own system of which I'm a part. And so it's a very uncomfortable position for me. But I think that we absolutely need to say that. And like in the case of, the work of personal support workers and immigrants and immigrant women are disproportionately doing that type of work. And it's not that they have a natural predilection to that work. They take time, they learn their skills through the experiences, knowing the residents, and they have high quality work. And so I would challenge people. I mean, unfortunately, we can't do it now because they're all locked down during a pandemic. But if you spend hours and days and careful watching and observing the type of work that's happening, it would be very difficult for you to not say that that's skilled work. So then that would have implications in terms of our immigration system. We talk about, we have the selective immigration system. And so we skim, quote unquote, the best and the brightest from other countries. We take their human resources, their highly skilled human resources, from countries, and that has a disproportionate impact on their ability to develop. It's another way that we extract resources, from countries. We extract minerals, physical resources, and their human resources. So I think if we had a broader conversation about what are skills and what are important skills, that would have far-reaching implications within the immigration system and beyond.
Yeah, I think that the pandemic has kind of created an interesting opportunity for this conversation because it's created a shared language around essential workers in a way that we weren't really talking about before this. And we talk about essential workers, it's not just healthcare workers, but we talk about grocery store workers, and we talk about people who work in cleaning and people who work in the Amazon warehouse and people who work in waste management around our cities. And when I think of all of the residents who live at Romero House who've had jobs during this pandemic, every single one of those jobs would fall under a category of an essential worker. And I think that that's true for most of the people who are at least refugee claimants that we see in the type of work that people do. And so it's for our society has had an opportunity for us to reevaluate what is essential, what is the work that allow us to keep living our lives in safe and healthy ways. And so I think this is a really great opportunity for us to reflect on that and say, in what ways is the work that all of these newcomers are doing contributing in such an important way to the lives that we all live. So I hope that coming out of this, that language of essential worker doesn't sort of disappear after this pandemic, but that we carry it forward and allow it to revolutionize our immigration system.
And I just want to, I want to add a really quick comments. If you look at the express entry immigration system, we actually award points based on someone's language skills, based on someone's degrees, like how many degrees, like whether it's a master, it's a bachelor, it's a PhDs, to give them more points. The system doesn't really look at, okay, does the person have an organizational skills, have the person skills, have the management skills. Like we don't look at actual skills, but we call them skilled immigrants, but it's just based on credentials. So I think that's something that we need to reflect on moving forward. And also in terms of the word essential, whether we need a new definition of how we classified, how we defined essential workers. I'm just playing devil's advocate here, but if you look at the essential workers, these are essential workers who are doing jobs that Canadians don't want to do or feel disgusted to do. So should we, rename it to something, essential jobs? Should we just redefine them as jobs that Canadians don't want, and we do have a shortage? I don't know, but then it would be really, really a very cruel system if we select immigrants just to pick up shit, right? That we don't do in Canada. But how sad is that?
That's our temporary foreign worker program. It is.
Yeah, so we have about 5 minutes now to the end, so we'll wrap up right now. And so many questions are still coming in, but would encourage conversation to move over to our social media handles and also follow us on Instagram, Facebook, Twitter, LinkedIn to keep up with the campaign and all these discussions and insightful conversations we've had today. For me, my two takeaways have been 2 points. Public education, the need to advocate for public education. Travelers are not carriers. It is irresponsible travelers that could be carriers. The second quote that's my takeaway from today is, human rights are too important to hinge on promises or hope. So I hope everyone has had an insightful time at tonight's panel discussion. Like I said, feel free to follow us on our social media handles and keep up with this conversation. This event has been recorded and will be live on our YouTube channel, so you can always go back and revisit the points and drop comments and keep the conversation rolling. So at this point, we would like to give a vote of thanks. Thank you all for coming and for your time that you spent with us this evening. And Adi, would you have any other final comments?
I just had a thought because I like the TV show or the YouTube series Hot Ones. I don't know if anyone else here is a fan, but I wanted to give the chance to the panelists if there's something that you're doing in your own work that you would like to let the audience here know about. Maybe we can have a couple minutes for that. And thank you so much, Laura.
And I just want to say that we're always looking for story ideas, and we're, you know, in terms of the structuring of the newsroom, I belong to the social justice team. I just want to give you a brief introduction. So we try to look at stories, you know, immigration refugee stories from that social justice lens. And that's how we approach stories. And we always try to have the people's voices in the story, immigrants and refugees' voices in the story, because I think not only is that an empowering experience for them in those situations, but I think also, you know, Canadians need to hear those voices directly.
Yeah, absolutely. I also want to just put another plug for the Canadian Association of Refugee Lawyers that we work really closely with at Romero House, and they currently have a campaign going called Refugee Travel is Essential. So on the topic of this discussion, so there's on their website, and I can send the information to the organizers to share, but on the website there are like social media videos and images that can be shared, and people are encouraged to push this campaign with our elected representatives, but also with the public.
We will definitely refer that to our comms team as well. Thanks.
So the last thing that I'll mention is just work that we're doing at the Canadian Health Workforce Network to create a memorial for all of the healthcare workers who have died in response to COVID, you know, to name them where that information is possible, and to have their photo so that it's very clear who's dying from this in the care of older adults, in the care of all of us. So yeah, if you could pay some attention to that, that would be great. Thanks.
Okay, so we'll wrap up at this point. Thank you all once again for joining in, and we'll connect again sometime soon.